Thank you to these companies and organizations that make the Before I Die New Mexico Festival possible. A good goodbye. Gail Rubin puts the fun in funeral planning. Compassion and choices, improving care, expanding options, and empowering everyone to chart their end-of-life journey. Daniel's Family Funerals and Cremations, Fairview Memorial Park, Gabaldon Mortuary, Sandia Memory Gardens, and Vista Verde Memorial Park, all in the Albuquerque area. Estate Pros, offering professional dispersal of personal possessions due to a move, illness, or death. The Final Exit Network, educating about and defending the right to choose at end of life. French Funerals and Cremations and Sunset Memorial Park in Albuquerque. Gathering Us, providing in-person and virtual memorial services and online memorial pages. Keeper, providing hybrid and virtual memorial services and keeping memories alive with online tributes to preserve, celebrate, and share life legacies. Morris Hall, estate planning attorneys in New Mexico and Arizona. Remembering a Life, your guide to honoring a life well lived, from planning a tribute to mourning a loved one. And Retirement Extender, investment management services with a personalized strategy recommendation based on your needs and objectives. Welcome, everybody here in the room, everybody out there in Zoom land. This session is going to be a fascinating conversation about what you need to know about organ and tissue donation compared to whole body donation. I have two excellent experts who are going to fill us in and answer our questions. John Boyd and Alex Smith. Jonathan Boyd is the Director of Education for the American Association of Tissue Banks, and he has worked in multiple roles in tissue banking and the transplant industry. John worked with Carolina Donor Services for 8 years, and he is a certified tissue banking specialist. He's also an active member of the International Association of Coroners and Medical Examiners, the National Association of Medical Examiners, the American Society of Association Executives, and Donate Life America. Please welcome Jonathan Boyd.
So it's an honor to have the chance to join you all today. I'm going to speak with you briefly about some really high-level things surrounding donation that involves transplantation and also medical education and research. So I'm using slides. I know not everyone is, and I'll share a little secret, and that is that these are not only for you for some sort of visual, but they also keep me on track and make sure I don't forget any of the things I'm supposed to say. So as Gail mentioned, the organization I work with now is the American Association of Tissue Banks. I don't work directly in organ, although I sort of work on the periphery of organ donation. So I won't pretend to be an absolute expert on all things organ donation. But to provide some context, there is both living and deceased donation in tissue and in organ. Now, of course, that doesn't really apply to this forum, but just so there's a point of reference, people can donate kidney, part of a liver while they're living, and living tissue donation typically refers to things like birth tissue, so cord blood or placenta. For deceased donation, this will encompass deceased organ or deceased tissue. So when we talk about organ donation, that is going to be a whole functioning organ. And we'll get into those in just a second. But someone who's an organ donor is someone that is either brain dead, typically in the ICU, or who is going to pass without mechanical support. So someone that might be on life support or a ventilator, and if care is withdrawn, they pass within a defined time frame. So these criteria are very heavily regulated and overseen from the standpoint of how organs are allocated or how someone donates and that organ gets to a patient or recipient. That is handled by the United Network of Organ Sharing. And unlike what you may see on something like Grey's Anatomy, UNOS does not show up in an OR at a hospital. That's all remotely monitored, and the local organ procurement organization works with them and other agencies to allocate or assign those organs. The federal oversight, sort of the regulation and legislative aspect, comes from the Centers for Medicare and Medicaid Services. This is the standard setting body that will define metrics, performance criteria, et cetera. AOPO, you love acronyms, the Association of Organ Procurement Organizations, is basically our counterpart. So I'm on tissue and they work in organ. This group serves to promote advocacy, awareness, and sort of industry best practices and education surrounding organ donation, organ recovery, et cetera. And the criteria is going to be different state by state, and even between different hospitals, there may be different criteria or requirements in place. So I mentioned that a donated organ is going to be that whole organ, right? So this is going to be a very narrow window of opportunity. There are thousands more tissue donors every year than there are organ donors. That's because the organ has to be functioning, right? There has to be blood flowing, there has to be oxygen, because that organ has to function to replace a diseased or failing organ in a recipient. And that's going to include heart, lung, kidney, pancreas, and intestines. So when we talk about tissue, it's not as much functional as I would refer to it as structural. And like I mentioned, there are thousands more tissue donors every year than there are organ donors. And one of the main reasons is that form over function, right? So their tissue is really structural in nature when we talk about tissue, and I'll go into the grafts in just a second. Someone can be dead for hours and still be a tissue donor. They also don't have to be in a hospital unit to be a tissue donor. So that's that broader net. There's way more opportunity just based on those criteria. So someone can be a tissue donor from registering at the DMV, or their family can elect to donate at or after their time of death. We'll talk about some of those in just a moment. But the regulation and legislative oversight is also different for tissue. Much like biologics or medical devices and vaccines, tissues are regulated by the United States Food and Drug Administration. So AATB, the American Association of Tissue Banks, my employer, we develop industry best practices, standards, and Gail mentioned that certified tissue bank specialist. We have a professional designation for people that work in the field. The iBank Association strictly works with ocular tissue. So there's many different facets, a lot of groups involved, and it's a complex landscape. So also quite different than organ is the potential for transplantable donations from a tissue donor. So numbers really range, right? You'll see some places that will say up to 70 lives can be impacted, others that say up to 100. It really depends. There's a broad range depending on the type of tissues that are needed at the time, or other specifics like medical history for a specific donor. So what are some of those tissues? One of the more commonly known tissue grafts is skin. And what most people associate with skin is a treatment for burn victims. There's also full thickness skin, which, like it sounds, is the complete layer of skin. And that is typically used for things like reconstructive procedures, like reconstruction post-mastectomy, or repairing a rotator cuff or a hernia repair. Bone and soft tissue, like tendons or ligaments, have a really wide range of uses. One of the more common uses for bone is in dental reconstructive procedures. If the tooth under the underlying jaw, the bone has degraded, the tooth may be at risk, and donated bone can actually be used to repair and rebuild that area. For tendons, one of the most common uses is for repair of ACL or PCL. Other sports medicine reconstructive procedures, of course, like repair of a meniscus or a joint surface. Hartford valves are commonly used for the repair of valve disease or something like aortic stenosis. Saphenous veins can also be used for things such as repair of peripheral vascular disease or coronary artery bypass. Whole body donation in kind of our scope of things is a little bit different than what Alex will get into with the forensic side of things. With our organizations, whole body donation is going to predominantly be for medical research and education. So one of the common cases is a whole body that's used in training paramedics, EMTs, or surgeons. And what I hear discussed over and over again is that ripple effect that comes from whole body donation, that where one graft might impact one person, a surgeon may train on someone who's elected to donate their body to science and may go on to perform hundreds or thousands of surgeries. So there's a really wide ripple effect that can come from whole body donation. Let's talk briefly about, and I say briefly because I think I talked longer than I intended to on those first couple of slides. So the donation process is different, like I've said a couple of times, from organ to tissue. With organ, every death, every case has to be an inpatient hospital death. With tissue, that's not the case. Let's use Virginia, for example. Virginia has a program with the State Highway Patrol, where the highway patrol officers have been deputized by the state medical examiner's office and can actually refer deaths for tissue donation. Only about 20% of deaths in the United States occur within the hospital. So this obviously means there's a significant number of potential donors that are never referred, never have the option to donate. For this reason, many organizations will work with funeral homes, coroner's offices, or law enforcement to have the opportunity to approach those families and provide the opportunity to donate for people that otherwise wouldn't have had the chance. Authorization or giving permission for donation can happen a couple of ways. I mentioned the DMV, that hard on your driver's license. That's what most people think of. But also, if you haven't completed that, your family can elect to donate at the time of death. The family's decision does not overrule what you select when you decide to be or not to be a donor. They cannot overrule that. That was your decision. For hierarchy, I left this bullet point in here, but that is a very, very deep discussion. So we'll just move on. The next step, I want to talk a little bit about what we do to make sure tissue is safe. So what we do to assure that patients have minimal risk when receiving transplanted grafts. One thing we do is a risk assessment interview. And if people are considering donation, especially in this forum, this is important to note because that history is going to have to be completed by a close family member or someone that can provide an accurate medical and social history for you. That's going to include things like drug or medication use. One thing we'll be looking for is possible illicit drug use. And the reason we look into all of these things is to mitigate risk of infection or disease transmission. So, for example, for illicit drugs, the CDC correlates HIV and hepatitis, an increased risk of HIV and hepatitis with non-medical drug use, in particular, intravenous drug use. So, for example, if a potential donor is an active IV, non-medical IV drug user, then they will not be a candidate for donation. Travel history. This is easily a 1-hour topic in itself, but I'll just give you an example. Travel to South America has an increased risk of Chagas disease or Zika, depending on the time of year or location. So this might not prevent us from moving forward, but it may lead to additional tests. Medical records, this one is a little bit more self-explanatory, right? So we'll be looking for things like possible infection, diagnosis for malignancy, And things like autopsy reports are also important. We have to make sure that the tissues recovered are safe and don't pose a risk for recipients. And additional records may be requested, things like emergency services reports, primary care records. And of course, if it's an inpatient hospital death, we'll be reviewing all of the hospital medical records. Even if the history is completely clear and nothing shows on the medical records, we're still going to complete a full infectious disease panel. The panel shown here, HIV, hepatitis, syphilis, these are required for all tissue donors. And even if there is a false positive, meaning a confirmatory test is negative, we still will not transplant that tissue. For microbiology, basically testing to see if there's any bugs, anything growing on the tissue that shouldn't be. And histology, if there's concern for cancer, pathology will be completed, and we would be checking to make sure that there's no malignancy or potential for cancer in that tissue. So I mentioned the variation in time requirements with organ and tissue. So I think this is one thing that's interesting, especially considering this forum, is that technically a family member can call in a death and say, my loved one passed and they wanted to be a donor, but they died at home. Assuming that that death occurred fairly recently, there's still an opportunity for them to be a tissue donor. Tissue recovery can commence up to 15 hours from the time of death. And there's some criteria that come into play, like cooling time in a morgue, for example. But the big takeaway from this is passing outside of a medical facility does not preclude someone from being able to be a tissue donor. Physical assessment is sort of that next layer. So we look at that, the medical history, the history provided by the family or historian. We'll complete an infectious disease testing panel and also a physical assessment. So more prevalently, I would say with younger donors will be an example like a 20-something-year-old on the East Coast in college. Next of kin is the mom on the West Coast, hasn't seen them for 4 years. And mom says, no tattoos. We get the donor and there are multiple tattoos. There's probably some holes in that story, right? So when we complete a physical assessment, we're not only looking for any concerning information, but we're also making sure that there's no contradictions in the history, the medical records, et cetera. Another example would be a surgical scar and we have no record of surgery. So maybe some concerns. The big question then is, what else do we not know? So I think I had 20 minutes assigned, 19 minutes, right on point. I think next is going to Alex, but I hope there's a ton of questions. And I realized as I clicked next that I failed to mention a bullet point I added afterwards, which is the funeral and burial services. So when tissue donation has been completed, donated tissues are replicated or reconstructed. So for example, for bone donation, we use prosthetics. Soft tissue is replicated with cotton and every incision is sutured closed. So there is still opportunity for viewing. All of the reconstruction materials utilized are also cremation safe. So I know that is always a big question we get. All right, and this is my contact information. Feel free to email me, call me. If we run out of time for questions at the end, I'm happy to connect.
That is amazing. I had no idea all of that information you shared with us. It's a lot more involved than I realized. So I know I'm going to have some more questions to ask you after Alex's presentation. Let me introduce to you Alex Smith. He is the lab manager of the Forensic Investigation Research Station, also known as FIRS, F-I-R-S, at Colorado Mesa University. FIRS is also known as a body farm, and Alex will tell us a little more about it, but to give you a quick overview, it's an outdoor facility focused on research, teaching, and service regarding the decomposition of human remains. And it's one of only a handful of such facilities in the United States. Alex interned at FIRS in the fall of 2017, and he became its full-time lab manager in 2019. So please welcome Alex Smith.
Hello, everyone. Thank you very much for having me here today. I'm excited to be here with you. So basically, what we do, as you might guess from that introduction, is a little bit different than what John was just talking about. So I am going to talk to you a bit about what we actually do with the donations we receive and kind of how that looks, because it's fairly unique. But first off, let's just talk about what is this. I mean, we've got that term body farm out there. So what exactly is that? Well, that is a facility that does research on the process of human decomposition. Might wonder, why would we study that? I mean, it's interesting, obviously, but what purpose does that serve? What can we do with that kind of information? So the biggest application of this is going to be in the forensic context, as you might guess by the name of our facility, and just in life in general. People may die in different circumstances, and it might be a while before anybody finds their remains. And when that happens, it's really important to be able to look at what's going on and see what's happened. How long has it been since that person died? What happened that led to their death? What happened since then? And how can we read the different things that have happened, read those markers on and around the body, and figure out what exactly happened? So that's kind of the why part. For a little bit of background on the FERS facility overall, we opened our doors back in 2012 and had our first human donation in 2013. Since then, we've had about 150 human donations to our facility. 70 of those are now in our skeletal collection, which I'll kind of talk about what these different stages are. And we also have about 200 people who are alive in the world and have signed up to donate to our facility when they die. So, as was mentioned, there are a number of facilities around the world. The number is slowly rising, but it's about 10 or so right now that do what we do, study the decomposition of human remains. And they do this in different environments. Each of those facilities has kind of a different focus as to what they're looking at. We specifically started to first started in the beginning for the purpose of looking at what the environment where we are does to the decomposition process. So to kind of explain that, when we started, there were about 6 facilities in the world, and all of them were in the southeastern part of the United States. They were all in a fairly similar climate zone, so they had high humidity, lots of precipitation, hot summers, fairly moderate winters. They were all pretty similar environments. On the other hand, FERS is located in just outside of Grand Junction, Colorado. That's the side of Colorado that's essentially desert. So we are located about 4,600 feet above sea level. We see beautiful sunshine almost every day. We have almost no precipitation, very low humidity. So all of these factors are going to come in and change what that decomposition process looks like because it changes basically everything about what's going on in our environment. So why not that? So the main goal of FERS when it started was just to see what those differences are and how can we quantify those differences. Because if, for example, the coroner here is looking at a body they found here and trying to use information that was gathered from someplace in the southeastern US where it's super humid and there's trees and the environment's completely different, they're going to end up making some assumptions about what happened to those remains that aren't going to be so accurate because things are different here. So one of the big differences is that in that southeastern US environment, you can see soft tissue breakdown to the point of just a skeleton in a matter of months. Here we have a donor that's been outside since January of 2014 that still has a lot of soft tissue, and it is still slowly breaking down over time. We don't know how long that's going to take, but we're trying to find out. So as far as the kind of research we do using the remains that are donated to our facility, we are looking at that extended time after death, because we see that soft tissue for years and years and years after death. So how do we tell if it's 2 years or 4 years or 8 years? What's the difference? And we're trying to approach that from a few different angles and really narrow that down. We're also looking at just the environment overall. So what is coming in to interact with the remains. So that includes things like insect activity. One thing that people often hear about, just kind of in our culture with crime shows and things like that, is that bugs show up on a scene, and that's absolutely true. Immediately after death, you'll see blowflies come in on the scene and come to the body. And blowflies can be really useful in an investigation because their development is highly dependent on temperature. So if you know what temperature it's been while that fly has been around, you know how long it took for that fly to grow up to that age. And if it arrived at the body and started its development cycle then when the person died, you can have a great estimate pretty early on for earlier stages of how long it's been since the person died. So we have identified so far about 5 different species of blowflies that are commonly seen in our facility. And some of those are common in other places, some of them are not. And by looking at the development of the ones we found here versus ones that are from other places, we noticed that there are differences. So even when you see the same species in different places, there's going to be differences that you need to account for. And so having a facility here and having another facility somewhere else that is looking at the same things helps us understand what those differences are. And so we can know what our environment is really doing and be able to provide a lot more information in an investigation. Other things that happen at the facility here that we look into are things like scavengers. So we do keep the remains protected. We want to keep all of our donors safe, but smaller animals do come into the facility and scavenge the remains. And that can be really important to know about for an investigation as well. Scavengers can completely destroy all of the evidence you need to figure out what happened if they interact with remains and consume large amounts of tissue or break down the body. Smaller scavengers might just consume tissue right in the area where the evidence you need to find is. So like if someone died a violent death and then a scavenger comes in and scavenges away the tissue around where that traumatic injury is, you might not know it was even there. So understanding what impact they can have is really important in understanding the greater picture of what's going on. Another thing that FERS is looking at is high altitude. So I mentioned we're at about 4,600 feet. That's about twice the elevation of the second highest altitude facility in the US and in the world, at least at the time we started. But we wanted to look at that at kind of a more intense level. So we actually opened up a second satellite facility. It's called FERS TB40, or the Back 40. It's a 40-acre plot of land that we're just starting to do research on up in the mountains here in Colorado. And still in the early stages there. We just started placing human donations up there last year. So hopefully we'll start getting a much clearer picture at what high altitude decomposition looks like through that facility. Another central piece of what we do here and what our donors contribute to is education. So we are one of 2 facilities in the world that focuses on undergraduate education. So we have an internship program where we have students come in and work with almost every part of what we do working with the remains from day one all the way through till their skeletons and working with their skeletal remains. Students are involved in all of our research projects. They do their own research. They contribute to basically everything at the facility. We do also, when requested, work with law enforcement to help provide information about investigations, search for remains, whatever the case may be. And we bring our students with us on those cases so that they can get that experience. We also do some continuing education courses to provide more knowledge for people in the field. So, for example, we have my favorite of the continuing education courses. We have a human remains detection dog course, or cadaver dog course, where we have about 24 dogs a year or so come in and get the experience of working with full sets of human remains. This is massively important because it's very difficult to for those dogs to get experience working with human remains, particularly larger sense sources, because as you can imagine, it's not exactly easy to get access to human remains. So being able to come to a facility like ours where the dogs and the handlers can see what that situation looks like, the dogs can get the experience of working with a whole body, the dogs can have whatever reaction they have in an environment that's safe, that's controlled, and that is not going to impact an investigation is massively important. And we've been offering that course for I think about 5 years now, and we'll hopefully continue offering it into the future because it provides a lot of great opportunities for the dogs and for their handlers to kind of understand how that situation is going to go when they're out on a search and they need to find human remains. We also started doing a human remains recovery course for law enforcement that hopefully we will continue in the future. That involves things like searching for remains, grave exhumation, recovering fragile remains, and other more complicated scenarios, including like hands-on experience. We actually have some of our donors at our facility are buried. Most of our donors are on the surface. Some of our donors are buried, and those buried individuals are part of our human remains recovery course, so that law enforcement can get those experiences and learn techniques for recovering remains in an environment that is not a crime scene. So as you can see, we use the remains we have here in a variety of different ways. And everything that we do here at the FERS is made possible by our donors and their families and the generosity of them allowing us to work with their remains or their loved ones' remains, which is absolutely massive. And that's true for any facility like this. So you might be wondering, how do we get the remains? Where do our donors come from? Our donors all specifically donate to our facility. So we have specific paperwork for the FERS that's on Colorado Mesa University's website that comes straight to me. So everybody who is here, they or their family knows exactly what's going on. So it's not like a general donation to science type thing. It's specific to our facility so that we're a bit different. And this might not be for everybody, but for some people, this is exactly what they're looking for. And so knowing that this is exactly what's going to happen is important on both sides. As far as the types of individuals that we accept, we are pretty open about most things. We do accept individuals that for long after death, so even if they've decomposed, because there are still lots of things we can learn from them. Even then, we don't accept though certain diseases that live in the body after death, because we do prioritize the safety of our staff over accepting those donations. That's things like HIV, hepatitis, MRSA, tuberculosis, and some other things as well. We also don't accept embalmed remains simply because if the remains are embalmed and preserved, that kind of gets in the way of studying decomposition. But generally speaking, we're pretty open about all the various things we might accept. So barring those diseases, cause of death, generally speaking, doesn't end up being having an impact on donation acceptance or anything like that. One thing that is different about this versus some other options for donation, for whole body donation, is that we do keep the remains forever. I mentioned we have a skeletal collection. We do spend a lot of time working with our skeletons, doing research, and also working with students and teaching them how to understand what's going on in a skeleton, learn about forensic anthropology. And our skeletons are essential to that. So we keep the skeletons forever. We don't return cremains or anything like that. As far as things that we ask from donors, as far as information goes, it's generally fairly straightforward. We don't ask, we don't mind having lots and lots of information, but we also understand that in some cases, next of kin might be filling out the paperwork and they might not know as much information. But we do ask for things like medical information. So what kinds of diseases have they had? What kind of traumatic injuries have they had? Medications? Do they have tattoos, body piercings, things like that? All these things have the potential to have an impact on both soft tissue decomposition and also what we're going to see in the skeleton. So it's really useful for us to have lots of information about this stuff if it's available. So generally speaking, that having that information is really important for us, and makes a big difference in everything that we can do. Again, everything that we do is made possible by our donors and their families. They're hugely important to us. We are also not the only facility in the world that does this. As I mentioned, there are a bunch of other facilities. We are the farthest to the west right now in the US, but there are lots of other facilities that all have different focuses and do different things with their research along these lines. Thank you for listening, and I'm looking forward to answering all your questions.
Thank you, Alex. Yay. So one of the benefits of donating your body to science, either whole body donation or the organ tissue donation, I think there might be some confusion out there about how do you get a free cremation donating your body? And I'm thinking maybe this is something for John to tackle first. Alex, you've told us you get the body and the family doesn't get anything back. But there is a difference between like signing up on your driver's license to donate organs should you be in a car accident versus donating your body, and some of these services harvest different parts and then cremate the body and return that to the family. So they get basically a free cremation in exchange. And I know there's been some stories about less than ethical providers out there. But of course, those aren't people who are with AATB. So John, would you maybe address those issues?
Sure. So there are a couple of different scenarios in regard to whole body donations for medical education and research. Cremains can be returned. In the case of organ and tissue, the family would still be able to proceed and move forward with whatever arrangements they had. Now, the practices of each organization are going to differ. Like, for example, organ procurement organizations, there's 57 in the United States. And their practices are probably going to be different from location to location. I know some, like where I was at before being at ATB, we would reimburse the funeral service provider based on cost incurred. We did not directly pay for the services because we didn't want it to be viewed as some form of exchange, basically. Some organizations will help. I know I've been involved in cases where the family didn't have means to pay for a service, and we supported the family in that capacity. But generally, organ and tissue, they're going to be able to proceed with their arrangements as planned.
And they would have to pay for those arrangements, the family.
Correct. That's
right. Yeah. Do we have questions in the room you'd like to bring up? I have a question about the how many women actually work in this field? Is that number growing? I seem to see a lot of women on the crime dramas my husband likes to watch.
I will say, as far as what we see at the FERS, almost all of our interns are women. I think we usually get like 1 or 2 men a year out of like 15 interns.
Wow.
So, yeah.
Yeah, well, actually, the forensic anthropologist for the FBI, Dr. Angie Christensen, sees the real bones. So I think there's a very strong female representation in the forensic community.
Cool. And the director of FERS is a woman, Dr. O'Connor. Yeah. So, yes.
I'm just curious if you think that Bones is actually influenced. That's a huge cohort that's all women in the sciences. Could it have made a difference?
Possibly could have. It seems a lot of people get excited about forensic anthropology and just overall crime scene related things via TV shows. So,
Would you? Oh, go ahead.
I was just going to say, there's a note here, John, you wanted to ask of Alex that if the FBI Forensics Anthropology Lab also worked with you all, is that possible?
We haven't worked directly with their forensic anthropology lab, but we have worked with the FBI on cases and crossed paths with those people. So occasionally, but not really.
Do the television shows get it right when it comes to the science? No.
No, they do not.
How far off are they?
They can be pretty far off sometimes. I know I've heard a common, at least for forensic anthropology, like a common assignment for classes is like watch an episode of Bones and write down all the things that are wrong. So
That's a good use of popular culture. So, John, there was a investigative report by Reuters several years ago about the body trade. Can you comment about that, about companies that are basically taking body donations and then profiting off of basically selling body parts? Is that an issue in this in the business?
Well, first, the selling body parts per se is highly illegal. I've got a friend that always says no margin, no mission. Most of the organizations are nonprofit. I think one of the common misconceptions is that that means there is no finance support anywhere. As far as the organizations that were referenced in Reuters, I think anyone can appreciate that there's misinformation that can be shared. Quite a few were not accredited by AATB, so I can't really speak to those.
Yeah. Well, both of you have worked with families who have the donation of the tissue or the organs as a result of tragic death or other natural death. What do you see happening with the families of the people who donate? Is that getting some good out of a tragic death?
I can talk about the organ and tissue side a little bit. So I think there definitely is sort of that silver lining for some folks. People do see sort of I don't want to call it a justification, but some form of reassurance that their loved one lives on. My mom is a liver and kidney transplant recipient, and her donor passed suddenly. So there is opportunity for follow-up. So my mom wrote her donor family a letter. Families can opt in or out of receiving follow-up. We didn't receive anything back with hers, but there are many that, sure people have seen stories where, the heart recipient meets the family and, listen to the heartbeat on the chest. So there's some of that provides some form of closure for them. And we refer to when donation can't take place, as we refer to it as secondary loss. So we look at sort of that stewardship of the donation process as a critical element of not only assuring patient safety, but also care for that family, trying to make sure we review everything we can to move forward in all possible cases.
Okay. Any questions? Yes.
Did I understand you to say that on the tissue and body donation that you don't take people with tattoos?
So the question is, with organ and tissue donation, you don't take people with tattoos?
That there was a bullet point about that, which is one of the items that we follow up with. So that would be a great example for filling in those gaps on the medical and social history provided by the family or the historian. So like, I have tattoos. I have all tattoos I wish I didn't have. But if my mom was my historian, she would not be able to answer the question, what tattoos I have, to correlate with a physical assessment. So when we look at those things, it's not necessarily concern of, is there a tattoo? It's making sure, well, first, it can be used as a point of identification. So if Jane Doe is supposed to have 5 tattoos and has 0, is it the right donor? But also making sure that we have all of the information. So tattoos are perfectly fine.
And if you're out there in Zoom land and you have a question, go ahead and type it in the chat. And yes, we have a question in the room.
Well, first, 2 questions.
2 questions.
Okay. The first one is, do tattoos affect the health of the person who received them?
Number 1, do tattoos affect the health of the person who's going to receive the donation? And what's the second question?
Well, you might actually be more able to answer this. In terms of religious or Jewish tradition, can a Jewish person give an organ? Isn't there some guideline about having to have
Oh,
full
yes.
body?
Okay, I'll tackle that. But so the tattoo question is, does the tattoo affect the recipient?
Yeah.
Okay.
The health of the body.
The health of the body of the recipient.
Sure. So this may be particularly connected to skin donation. And if there's a tattoo, it is not recovered as part of the donated skin. The tattoo itself would not have any impact on the quality or viability of skin or utilization for a patient. It's simply because, well, first, we don't want to give out that piece of identifying information, right? Some tattoos are very unique, but also it can be left with the donor. Some families want to have pictures of them or just don't want them to be removed. So tattoos would not be recovered whatsoever.
Well, and it's interesting in the funeral field, a few years ago when I was going to the funeral director conventions, there are companies that would harvest the tattoos and preserve them for the family, which is kind of creepy. A lot of people thought. But the other question she asked was about Jews and donating organs. And I can answer this because I am Jewish and I'm with the Hever Kadisha, the Jewish Burial Society. Traditionally, it was considered you wanted your body buried intact as possible. But given the fact that donating organs and tissue helps save lives, that is the more important concept. So that thinking, except unless you're Orthodox, they're just like, no, you got to be buried. They'll save an amputated limb to be buried with the rest of the body when that person dies. So, but for conservative and Reform Jews, it is the mitzvah of saving a life that overrides donating an organ. Yeah. Yes, back in the back.
At what age are you too old to be a donor?
At what age are you too old to be a donor?
There is no standard or regulation that precludes donation based on age. For organ, it's going to be based on function. I believe recently in Philadelphia or New York, I forget which one, they had their oldest organ donor on record, which I believe was 101. For tissue, it's a very similar thing. It's structural. So one of the concerns might be osteoporosis if there's bone grafts. For skin grafts, like for split thickness, for burn treatment, there's really no cap and no limit.
Alex, do you have any, no? They can be as old as they want to be.
No age restriction.
Did I see another hand in the room? No? Yeah? Yeah.
On the body farm, are they clothed so that they can also do forensics on the decomposition of the materials?
On the body farm, are they clothed so you can track the decomposition of the clothing as well?
Our standard protocol is no, unless the donor specifically requests to be wearing something specific. Like we had an individual who had a specific dress made. Dress. But generally speaking, no, because we need to be able to see what's going on with the decomposition process of the body.
Okay. Is there much of a interaction between schools that run body farms and the tissue bank organizations?
Not so much directly. We do work heavily with forensics on the front end. So the medical examiners and coroners, forensic pathologists, but not so much to my knowledge for the body farm side. Alex?
No, we kind of come in way after the fact. So we actually have accepted multiple donors who were tissue donors to our facility. So we're later down the line usually.
And in both cases with body donation and organ and tissue donation, if somebody has a communicable disease, you're not going to accept those donations. Is COVID considered in that communicable category?
From our end, it's kind of unclear as far as the survival of COVID and the ability to get it from a dead body. So until recently, we were not accepting individuals who died of COVID-19. We did accept one recently, but that individual had died 3 weeks prior, so feeling more comfortable with it. So as far as COVID-19 specifically, that jury's still out on that as far as I'm aware.
Well, yeah, it's a new disease.
So for organ and tissue, there's two sides to this. So for organ, the HOPE Act was passed, which then permitted HIV positive to HIV positive organ transplant. Other communicable diseases, it's a case-by-case basis. So someone who is going to pass away if they don't receive a kidney or liver transplant in a month, then the risk of hepatitis is lower than the risk of them dying without a transplant. For tissue, no one's going to die without an ACL or PCL repair, right? So we look at risk very differently, and we are much more risk averse. So that's why things like an unknown tattoo may cause us to walk away from tissue where organ's going to be perfectly fine.
Okay, makes sense, yeah. And one
For the body farm, how does the body get to the farm? Do you guys pick people up or?
body farm question. How do people get to the body farm? Or how do you get the bodies there?
It depends where they're coming from. Yeah, it depends where they're coming from. So within 75 miles of our facility in Grand Junction, we will figure out the transport. Either I will go drive somewhere and transport the body myself, or we will pay a funeral home to do it. Outside of that range, generally speaking, the family, we can help them as far as how to do it, but the family pays for the transport.
And do you have to get a burial transit permit from the funeral home to drive that body there?
Only if we're crossing state lines.
You have a process?
If they're crossing state lines and the funeral home in wherever state they are needs to take care of all of that. Not crossing state lines, it's not an issue to transport within the state of Colorado.
Somebody has asked a question on the chat. Is there a backlog of body parts for John? Question for John.
I wouldn't look at it as a backlog of body parts. So tissue, unlike organ, can be stored for an extended period of time. Many tissues are frozen at up to negative 100 degrees centigrade. So the tissue does not expire per se at that temperature. What expires is the validation of the packaging it's in. So if there's a cervical spinal fusion bone graft, it can be frozen, set aside, and ready, and it can be held for a few years before being implanted.
Wow, wow. Well, it's hard to believe, but we are coming up on an hour of conversation on this topic, and it's been so enlightening. Are there any last thoughts you'd like to leave us with?
Thanks for having me.
Yeah, thanks for having us here.
Hey, I really appreciate you coming on this afternoon on the eve of Halloween. And it's been an enlightening conversation. I really appreciate you taking the time to be here. Thank you to everybody here in the room. Well, thank you to Gathering Us for making all this technology possible. And we'll see you again soon.